All right, we are going to call this Finance Committee meeting to order. Present are council members Floyd, Frazier, Koss, Bub, and Marmee. First item on the agenda is to consider an appropriation amount of $50,000 from your friend and mine, Roger Loomis.
This is our annual vehicle replacement program. This is for 2 service vehicles in our service department that are over 10 years old that we're going to replace. We're appropriating $50,000 because we don't know what we're going to get for trade-ins and things like that. So that's roughly what we're going to spend. We'll probably spend a little less than that, but that's what we need for vehicle replacement. So.
All right. Motion.
Second.
Motion by Bub, second by Floyd. Any questions or discussion?
It's just trucks or
Service trucks, the ones you probably see around with all the boxes on the side and stuff like that. We generally run those about 7 years because they get a lot of miles on them. And again, so the 2 we got were, one's a hydrant service truck and one's a regular service truck, and they're pretty well beat right now. So.
Anyone else? Seeing none, all those in favor signify by saying aye. Aye. Those opposed, motion passes 5-0. And since we have so much on the agenda tonight, and I'm going to just skip everything else because the health department's here tonight and we want to give them ample opportunity to speak. So we're going to cut everything else from our agenda tonight. Is that okay with everybody? With that, we stand adjourned.
All right, we'll call the service committee meeting to order. Those present are myself, Rath, Koss, Bub, Frazier, and Floyd. Up first, since everybody's anxious to get the health department in and out of here, we will hear from Joe Evel, Lincoln County Health Commissioner, to give us an annual report.
Does anybody want a copy?
Yes,
here?
please.
So we've got some for the audience too, if anyone needs them.
I got one, thanks.
Thank you.
Thank you, sir. Okay.
Thanks, Joe.
That's what I was searching for. Couldn't find that.
Okay. Well, this is, I guess, my just annual update. Nothing too special to report. Just wanted to highlight some of the things that happened in 2016 with the health department, and kind of talk about a few things maybe going on in 17. Last year, the big thing that was happening at the end of 15 and then ran into the first couple months of 16 was we renovated our clinic space. The area that we use for clinic hadn't really seen any kind of a refresh at all in over 30 years, and was really kind of the oldest part of the building as far as renovations go. So we were able to get that renovated, have 4 nice new exam rooms, have something more like you would expect when you would go to a doctor's office, not someplace that's just a kind of clinic in an old 80-year-old building. So it makes it a lot better for our staff and also the people visiting our office. We had the lead in drinking water at Granville schools, where they had found elevated lead levels at drinking fountains and some other places in some of their facilities. We ended up testing, doing a blood lead screening for about 500 students and faculty. Found a few that were elevated, but really about the same rate that you would just expect if you just pulled 500 people off the street. So fortunately, no real health impact that was observed. But we did work with most all the other schools in the county to arrange testing of their water to make sure that there weren't problems, as well as with some private businesses that we help them with any concerns that they had as well. I do want to mention, I've got here tonight Chad Brown. He's our environmental health director, so he was involved heavily in the lead cases, but he's over all those environmental programs. I've got Barb Lanthorn, who's my director of administrative services, so all the business thing, and Olivia Biggs, who's our new last year, our public information officer. So she put together the report, and all the Facebook and Twitter and all those things that you see that we're trying to get information out to the public. She's tasked with taking care of that and doing a real good job for us. Last year we did launch a newborn home visitation program. As you know, Ohio has one of the worst infant mortality rates in the country. In Licking County, our rates are a little bit over the Healthy People 2020 goal that the CDC sets. Theirs is 6 infant deaths per 1,000 births. This year it looks like we were about 6.2. The state a little closer to 7.2, because it's really much higher in some of the urban areas than it is in the rest of the state, but it's still still a problem here. Every child that dies unnecessarily is a major loss. So it's something we're still focusing on, trying to get the nurses out, do those home visits, make sure that they have everything they need, make sure they know how to take care of the child, make sure the child's thriving, and there's no charge for that. We also have, with that program, car seats. If someone can't afford a car seat for their child, we can provide those. And if they don't have a safe sleeping environment, which is often what ends up killing the children besides health effects or prematurity, the accidental ones a lot of times are because they don't have a safe sleep environment, that we can provide pack and play type cribs to those households so that they at least have some dedicated space where they can have that child safely sleeping. We opened our half-mile walking path around our facility. So it's a paved kind of multi-purpose trail, but it just makes a big loop around there, and we have people out there pretty much every day, rain or shine, it seems like, using that live up in that kind of northwest corner of town. But we also have people who drive out there, but a lot of the people will come out, walk their dogs, go around and get their exercise, as well as our staff. So it's being well used. Hopefully, our goal at some point is to get it connected to where the bike trail ends at Goose Pond, get that stretch connected through there, but that's a bigger challenge. Grant-wise, we expanded our breast and cervical cancer program. We now serve 14 counties in central Ohio, all the way up to Ashland, and so that's a state grant. There's just 5 regions, and we cover that central region. And our radon grant, as you know, Licking County has the highest indoor radon levels in the state on average, and we're now the central grant for 17 counties in Ohio, kind of the whole eastern region, that we coordinate the efforts for the Ohio Department of Health in that half of the state, more or less. We also received a $300,000 grant last year. It's technically under the Water Pollution Control Loan Fund. Did I say that right? But it's to help low income all the way up, I think, to 200% of poverty is the cap as far as assistance, but to help pay for replacement of sewage systems that are failing people's homes. So depending on income level, it can pay up to 100% of the cost of that. And now we spent about half of that so far. We need to spend the other $150,000. So trying to get the information out now. The spring's here again. A lot of times we find out people know their sewage systems failed, but they're not going to call the health department and say that they have a problem, and we're kind of waiting for someone to catch them. But if they find out there might be assistance out there, hopefully they'll voluntarily come in and say, yeah, I've got this problem, and see if there's something we can't do to help them out. We also received for 2017 another $300,000, and that will.
If we take questions.
Yeah.
Can I ask you a
Sure.
quick question? Are septic companies in the city of Newark, if they have to make a repair, are they supposed to notify the health department?
It depends. If it's just a minor repair, they don't. Although if they're doing any service, even pumping, they're supposed to send us paperwork on that. But as far as a permit, they would only need it if they were making an alteration or some kind of a major repair.
Okay.
So.
Thank you. I'm sorry.
Yep. But the $300,000 that we will receive for 2017-18, they expanded it to now allow it to help pay for abandoning the sewage system and connecting on to central sewers. So that, I know there's a lot of places in Newark where sewers either aren't available right near it, or they weren't at the time the house was built, so there's still houses that are not connected to sanitary sewers. So hopefully we can work with you guys to bring some of those systems online and get them connected to the sanitary. Let's see. On our property, we did a reforestation project with the U.S. Fish and Wildlife Service. They planted 350 trees out there on our site to try to do some habitat restoration. We also had volunteers from Granville High School class come out and help with that project. And we worked a lot with the Canal Market District to help make that a success and open it up to, the WIC, being able to take WIC coupons there and trying to get healthy foods in the community. So pretty busy year last year. For 2017, we're continuing a lot of that stuff, but we do have a new grant that's for prescription drug overdose prevention, and that's mostly targeted toward opiates as prescription drugs. But with that, we'll be forming an overdose death review committee, and there's wording in the proposed state budget that would formalize that, so we don't run into problems requesting medical records and people saying, oh, that's confidential. We have the same thing in place for child fatality review, which actually meets this week, where we look at all the child deaths for the previous year and then try to decide are the things that we could have done that would have maybe stopped or been able to prevent that. With that grant, we also will have a drug abuse prevention coalition that we're forming, and I think they're scheduled to meet in March for the first time. Let's see. The other thing that we're working a lot and they're really trying to get the word out about is our Project Dawn, our naloxone distribution, where people who either, if they could be a drug user or a family member or a friend or somebody who just works somewhere where they may run across someone who's overdosed, they can get free naloxone kits that, with a little bit of training, they can hopefully, save somebody's life in that time between the time they call 911 and the EMS gets there, that they're able to intervene and hopefully increase the chance that that person will survive. And those are through a state grant, so we are having a distribution event. Was that Wednesday? The 6th. So that's still open to additional ones. We're working with that at the Look-Up Center. So we're trying to get those out there. Certainly our first responders have them and use it quite a bit, but people that are living in a household or have a family member, it may mean the difference between having that second chance to be able to quit at some point and never having that second chance. So.
Joe, how many of those are you distributing? What's the shelf life on those?
We had 350. I think we're down to about 150 that we want to get rid of before summer, and probably we'll be getting some more. The shelf life on them is at least a year, depending on when they were manufactured, so probably a little longer than that. So I think that's most of what I had as things I wanted to highlight, but certainly I'd like to ask it or take any questions.
Ms. Floyd?
What do you see as the top 2, 3, 4 health problems in Licking County? I know you've always talked about tobacco use as a biggie. Right. But.
Yeah, the big three continue to be tobacco use as far as preventable causes of death, and then it's obesity-related things, active living, and healthy nutrition. So those are our three big priorities. The state just released their state health improvement plan, and those are the three big health priorities as far as from the public health perspective. And then, of course, they have mental health as a big item in there as well. So those three things continue to be a big problem. If you look at what really is causing the most death in our county, statewide, the graph that I just saw, if you looked at years of potential life lost, meaning how many years before you turn 75 did somebody die, the drug overdose is now the highest thing on that list. So that's new within just the last couple of years that's kind of taken over. It's still, the numbers are still comparatively low compared to heart disease or cancer, but as far as the potential lost, if you're someone who's dying at 22 years old, that's a lot of potential life that they've lost there.
Thank you.
Mr. Marmy?
Yes, the spraying for the moths. Is there going to be a schedule out? I'm already hearing organic gardeners saying they want to know exactly when it's going to be in their area, so then they can cover up or do whatever they need to do.
That's being done under the Department of Agriculture for the gypsy moth control. So about all I know is what I got the letter and what I looked up on their website when I got a call about it. It's more of a pheromone type product. It's not a normal pesticide.
Okay.
So probably not something that would cause them to have a real issue. But I'm sure there's a notification that they can sign up with Department of Agriculture to find out.
Okay. Thank you.
We did get a grant from EPA this year that we'll be replacing all of our mosquito sprayers with new equipment. And that's kind of to make sure we're geared up and ready in case we have to step things up for Zika, because that still is a problem that's coming up from the south. And if we do start getting some more cases here, in the winter, we're fortunate we don't have to worry about it. But once the mosquito season hits, if we start getting international travelers coming back that are infected with Zika, we'll have to try to make sure they don't spread that to our local mosquitoes and then start it around here.
Joe, one of the statistics I noticed when comparing year to year, statistically, there's a significant increase in home births. What do you attribute that to?
I think there's, a movement where, with natural birth, home birth, water births. Part of it's that. Also, the Amish population that we do have in part of the county is part of that as well. So I think it's, like organic gardening and a lot of other things, it's kind of a trend.
Or a fad? All right.
I have a question. For your program participation for WIC, have you seen substantial increases based on partnering with the downtown market, or is it the same numbers, just different access for those people?
Yeah, our WIC numbers have, I think statewide, have been down a little bit lately from where they historically have been. But as far as the utilization of that farmers market and the other markets that we partner with, our county has been real high, kind of a model around the state as far as that, being something that not just that we offer, but people actually take advantage of.
Joe, I'll ask you the same question we ask every year. Are we any closer to being able to identify City of Newark services as opposed to Licking County or 43055?
I think for a lot of our programs, we know that because it's especially the ones where our staff are doing visits, whether it's home visits or whatever, because they have to log which political subdivision they're in all the time. So those are pretty easy, and we can run that. We have a new medical record system. So I know we're looking right now to run a new report on disease rates by zip code and political subdivisions and things, looking at some of that. And we should be able to look at some of our clinic numbers and be able to pull that out a little bit better, assuming that we're getting good information into the system, because otherwise the report will still not be right. But we're working on a lot of quality improvement around that database to be able to make sure we're using it the best way we can, and that to be part of what we're looking at is being able to make sure we have good address data that we can then pull reports out of. I know with the with the births, we're now getting access that we can go into the state database and pull up a lot of birth information. So we're pulling up like all Licking County resident births, no matter where they are in the state, and so there are some things that are getting more sophisticated and make that a little bit easier.
All right. I got it.
As far as like your three main items with tobacco, exercise, and nutrition, how do you measure that to see if we're making success or
the main ones are tobacco use. There's two surveys we just did in 2015, the behavioral risk factor surveillance system survey, where we hired Wright State to do 500 households where they call both cell phones and landlines and ask those kind of questions about tobacco use. And then for youth, there's the Oh Yes is a new youth survey that some of the schools are using. And then we did the Pride survey in the schools, so that we track in that as well. So we can look at, all kind of average high school grades or just by senior year. The other ones are largely from the BRFSS survey, because we collect their height and their weight, and we can figure out obesity. There's questions about vegetable, fruit intake, things like that.
And is that every year that you do those surveys?
We do those every 3 years typically.
Any other questions from committee members? Any other questions from the audience? Joe, thank you very much. The rest of you guys, thank you for coming in. We appreciate your time. We'll see you again
Thank you.
6 months or so. If you guys would like to stay and listen, subject yourselves to that, feel free. If not, I'll give you a minute to leave.
You might as well sit down.
All right, up next is ordinance number 17-08, an ordinance approving the editing and inclusion of certain ordinances and resolutions as parts of the various components codes of the codified ordinances, provided for the adoption of new matter in the updated and revised codified ordinances, repealing ordinances and resolutions in conflict therewith, and declaring an emergency. If you make me read that again, I'm going to hurt you. Wow.
I'm with you. I'm just kind of carrying the water for the law director's office. This is something they do from time to time that they have to do. And if you have any detailed questions about the numbers, the ordinances and that, I'd ask you to just call the law director's office directly.
From the way I understand this is standard operating procedure. We do this on an annual basis.
That's correct.
It just updates our books
Yep.
to keep them updated with the state.
Second.
Okay, motion by Floyd, seconded by Bub. Any questions from the committee members? Any questions from the audience? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? That passes. We'll go on to full council with a vote of 5-0.
Thank you.
Up next, we will have resolution number 17-12, authorizing and directing the Director of Public Service to accept bids and sell certain surplus personal property now owned by the city of Newark, Ohio, declaring that such property is no longer needed for any municipal purpose and declaring an emergency.
This is nothing more than an impound lot sale. We do this a couple times a year. The sale date is April 8th, and when you walk that date backwards, that's why we're asking it to be an emergency, so we can meet all the deadlines that we're legally required to meet for advertising purposes. We have 108 automobiles. No, I'm sorry, 106 automobiles, some bicycles, some furniture, and some other things from city departments. If you haven't been out to the city auction, I'd encourage you to come out and watch it. There's a lot of things being sold.
Motion.
Second.
Motion by Bub, seconded by Frazier. If you do go out to the auction, get there early, it does not last long. I found out last time.
Moves right along.
Any questions from the committee? Any questions from the audience? Seeing none, all those in favor of passing this on to full council signify by saying aye. Aye. Opposed, same sign. That'll move on to council with a vote of 5-0.
Thank you,
And
Mr.
that-
Chair.
Thank you, Mr. Rhodes, appreciate it. And that concludes Service Committee. Up next will be Capital Improvements.
Calling Capital Improvements Committee together. Members present are Hall, Rath, Roletta, Frazier, and Johnson. We're discussing Resolution 1713, authorizing, directing the Director of Public Service for the City of Newark, Ohio to enter into a lease agreement with Heartland Bank for the refurbishment and rehabilitation of one fire apparatus for the Division of Fire.
Thank you, Mr. Chair. A couple weeks ago, we were in asking council to give us the ability to have a fire engine refurbished. We asked you to give us the ability to waive the bidding because there was one type of company out there to do that. That is on the second reading, so I thought I would start this process, which is the financial end, asking you to give me the authority to enter into a lease agreement to refurbish that fire apparatus.
Any questions?
Make a motion.
Motion by Rath,
I'll second.
second by Frazier.
I have a question. Do you have a dollar amount?
$93,183.
183?
If I'm off $1 too, don't.
I'm gonna hold you accountable, public record.
3 years at 2.5%.
That's what I'm looking for.
Any other questions? Questions from the audience? If not, all in favor say aye.
Aye.
Those opposed? Motion passes 5-0.
Thank you, Mr. Chair. Thank you.
Personnel Committee is next.
Okay, it's 6 p.m. Before we start this meeting, Mayor Hall, is Barb Jobs presenting this?
No, we're going to do it. She had to be out sick today, so we're going to talk about it.
Very good. Okay.
Brother Kirkland.
Okay, it's 6 o'clock. We'll call this Personnel Committee meeting to order. Those present are myself, Ryan Bubb, Doug Marmee, Curtis Johnson, Alex Roletta, D. Hall. Substance of discussion is Ordinance 17-09. It's amending the position classification pay range of the Income Tax Office by abolishing 1 Revenue Clerk 1 and creating 1 Revenue Clerk 2, setting compensation therefore, and declaring an emergency. Personnel Director Mike Buskirk is at the podium. Go ahead.
Thank you, Mr. Chair and committee members. It pretty much says it all. Barb has more work in the level of a Revenue Clerk 2 than she does as a 1, and you can, if you look at the chart, you can see she has 2 1s. What she's proposing is to do away with one of the 1s or abolish it and create a new 2. And we've talked with her, and she already has it in her budget where she can do that, so it won't really change anything.
Okay.
Motion.
Second.
Okay. There's a motion on the floor by Johnson, a second by Roletta. Does anyone from this committee have any questions or comments? Anyone from the audience? Seeing none, all those in favor of moving this on to full council signify by saying aye. Aye. Those opposed? Motion passes 5-0. Thank you.
Thank you.
Take that up.